Hello students, welcome to acupuncture and Mark Sebastian class. In this lesson, we will learn the acupuncture and the Mark Sebastian treatment of cough. This knowledge point is divided into 4 parts. First, let's learn the part 1, Introduction. Cough, a main symptom of the lung problems, may result either from attacks by exogenous factors disturbing the dispersion of qi of the lung, or from disorders of the lung itself or other diseased zang organs affecting the lung. In modern medicine, cough is commonly seen in upper respiratory tract infection, acute and chronic bronchitis, and other disease. Part 2, Etiology and Pathogenesis in the theory of TCM. Once the lung is attacked by the exogenous pathogenic factors, the defensive system of lung is invaded by pathogenic factors. The qi of the lung is blocked and fails to descend, thus resulting in cough. Secondary, cough resulted from functional impairment in zang organs falls into the category of cough due to internal injury. Part 3, Differentiation. First, evasion by the exogenous pathogenic factors. Main manifestations are cough with short duration, sudden onset, or associated with external symptoms. If it is due to aversion by pathogenic vehicles, there may appear cough, itching of the throat, thin and white sputum, aversion to cold, fever, anhidrosis, headache, stuffy and runny nose, thin white tone coating, and superficial pulse. If it is caused by wind, heat, there may appear cough with yellow and thick sputum, choking cough, thirst, sore throat, fever, or headache, aversion to wind, sweating, thin, yellow tongue coating, floating and rapid pulse. Second, internal injury. Main manifestations are cough with gradual onset and long duration, accompanied by functional disorders of zang organs. If phlegm dampness invades the lung, it manifests as cough with profuse, white, and sticky sputum, stuffiness in the chest and epigastric region, loss of appetite, lassitude, white, sticky tone coating, and soft rolling pulse. If the liver fare harms the lung, cough with ascending qi, hypochondriac pain, scanty sticky sputum, red face, dry throat, yellow dry tongue coating, wiry and rapid pulse. Deficiency of lung yin may give rise to dry cough without sputum or with scanty sputum, dryness of the nose and the throat, sore throat, spotting blood, or even coughing blood, afternoon fever, malar flush, red tongue, thin coating, sweaty, and rapid pulse. Part 4, Treatment. How to treat it with acupuncture and Mark Sebastian. Let's look at basic treatment first. Invasion by the exogenous pathogenic factors. Method: to dispel exogenous wind, activate the dispersing function of the lung, and to relieve the external symptoms and cough. Points mainly from lung meridian and large intestine meridian are selected. Basic points: 列缺、合谷、肺腧。Additional points: wind cold cough plus 风门, wind heat cough plus 大椎, add 少商 for pain and swelling of the throat. Manipulation. Reducing method is given for 2 types. Compared with the former type, the treatment of cough with its internal injury is different. Method. To promote the dispersing and descending function of the lung, resolve phlegm and stop cough. The points from tie-in meridians of both hand and foot and back shoe points are used as principal points. Basic points: 肺腧、太渊、三阴交。Flame dampness invading the lung, 丰隆、阴陵泉 liver fire harming the lung, 行间 lung insufficiency, 膏肓 add 孔醉 for hemoptysis. Manifestation. Both reinforcing and reducing manifestations should be considered in acupuncture treatment, all combined with moxibustion to strengthen the function of spleen and to resolve phlegm. In addition, there are other alternative treatments for cough. Topical application of herbs at point, 肺腧、定喘、膻中、足三里、丰隆。The ear points, lung, bronchial, 神门 and the spleen are selected. Point injection. Choose points 肺腧、定喘 and 风门. Cough is a commonly seen symptom in many respiratory diseases. Clear diagnosis should be made in order to combine necessary drugs or therapies. Attention should be paid to avoid cold invasion, smoking, and alcohol.